Eagle. I recognize some of the folks on the call today, and hope to get a chance to meet you around town. But today I'm going to walk you through some of the things that we've learned, because not only do we run a business and have to deal with all these concerns, but our company, provides safety consulting services. So we're being asked by a lot of our clients to help in this process. And I thought some of that information would be useful for you. So I'm going to try and share the screen over here to get the presentation up in front of you. So Mary Ann, if you could just give me a thumbs up if we've got the presentation in front now. Great. So I'll start walking through this. We're going to talk about a number of items today, and we'll see if we can get the technology operating. So here's our overview. I'm going to talk about, technically, there's currently still stay-at-home orders in place here in Colorado. They have been updated as of Sunday. And so, but some of the aspects of the original stay-at-home order still apply. So I want to touch on that. I'm going to give you a little bit of an overview about COVID-19. You probably have read a million and too many things about it, but we're going to talk a little bit about some of the key things that are important for everyone to know. Then we're going to talk about what's, I think, most important is the returning to work process. And there are multiple guidelines there. Just here in Colorado, in Eagle, we have 3 to pay attention to specifically: federal, because there are federal guidelines. There are state guidelines now, which were just brought out as of Sunday. And there are Eagle County guidelines, which we're probably most interested in, which came up really in effect as of yesterday. And then there's some other things to know about. The Center for Disease Control has some best practices out there. And then I think what's most notable to employers that might be on the call is that all of this activity related to COVID-19 is now also tied to obligations under OSHA. And I think, as we know as business owners, that has a lot of implications, both legal and otherwise, that relate that did not exist before. And so management and protection of your employees is also now an obligation under OSHA. And eventually we're going to get down to some best practices and some suggested next steps. So we got to walk through some of the basic underlying information first. And then I do encourage you to reach out with a chat function, and Mary Ann will be sort of collecting up those questions and can answer things either along the way or as we get towards the end. So we do have a current, and I should mention, all these slides, I think Mary Ann will have up on the chamber website eventually. And so you don't need to rush to write down all these links that I'm going to show you during the course of the day, because I am giving you a number of links to key documents that are out there. But you'll be able to get those off the website afterwards if you need them. So we do have a current stay-at-home order here in Colorado. It was in place through April 26th. It's now been updated to a current order about returning to work, or what they call safer from home, and that I'll get to next. But the reason that this is still important is it still establishes the definitions for essential businesses and other businesses. So those aspects are still critical. They still apply. And so there's aspects of this order that are still in play as we talk about getting back to work. So I'm not going to spend a lot of time on this because it's somewhat outdated by the current order, but it's important to recognize there are aspects of it that still apply, and that you should, when you need to see the definition of what's an essential business or not, you can still fall back on this document. So it does have a lot of importance. Knowing that we have that, I think that it's important to recognize, well, why is that? Well, because of course this COVID-19 virus that's around. And here's some important things that I think you should be aware of, that you've probably gleaned from other things, but to understand why some of the things that we're going to do later to get back to work are important, you got to really understand this virus and how it works. And these are the key points. And the one thing I would mention, because there's a lot of new information and a lot of varying information and a lot of disinformation, and part of that is because no one studied this. I mean, we've only known about this for a couple months now, realistically. And so there's not like these studies that have been done by, professionals for the last 20 years, figuring out everything there's to know about it. Anything we know, we only know of for the last several months. And so even some of that is wrong or incorrect, or it hasn't gone on long enough to really know all the answers, or there haven't been enough competing studies to disprove things and prove things and support things. So, but these are kind of, I think, essentials that are at the base of our understanding and are not really in dispute. I saw one very interesting note about this issue about water droplets, that what's happening is the virus really transfers by water droplets. And what's interesting about that is there's a lot of concern about, okay, if somebody sneezes and I'm in the grocery store and they're on aisle 3 and I'm on aisle 5, isn't that just all in the air and now I'm going to breathe it? And the reality of that is that's not really the case, because the water droplets tend to be relatively heavy. And I'm saying that in a relative way. They're not heavy compared to, us, but they're heavy compared to things that can transmit in the air. And so they tend to fall relatively quickly, which is where this whole 6-foot separation comes from. And the reason that's kind of interesting is that once you're beyond that 6 feet, these water droplets tend to fall. And that's why they don't get on you. And those that remain in the air, if they do remain in the air, are actually extremely small and don't really settle on things. And that's why they're not going to settle on your clothes. They're not going to settle on things you touch. They're not going to settle on you. You're not going to breathe them in, because these are, and while you maybe you would breathe them in, they're extremely small. And so think of it from a dose standpoint, very little dose that might affect you. So the risk becomes extremely low once you move beyond these heavier droplets that fall. Anyway, not to get too technical about it, but it's one of the things to, I think, bring some comfort that you're not going to walk into a space and the air is full of the virus and just by breathing it, you're going to get sick. That's not really how it works. So why does flattening the curve matter, right? We've heard that term a million times. And the reason, and these are numbers from Colorado here, the reason is because the impact's exponential. Just look at the dates at the bottom. On, early March, on the 8th of March, we don't even have a detection, right? No one's been sick yet. No one is confirmed sick. And then within 10 or 15 days, we are into hundreds of cases. Just sort of like nothing to hundreds and then thousands. It just is exponential in its growth. And so when people talk about flattening the curve, it's not that that eliminates the disease. All it does is allow us to create capacity in the healthcare system. That's the purpose. So, and why is that important? Because if we have capacity in the healthcare systems, people, by and large, do not die from this virus. When we don't have capacity in the healthcare system is when we see the mortality rates really skyrocket, because we can't help those people. And that's really the key to the whole story here, is that we want to keep the impact from the virus at a level that our healthcare system can manage it. We aren't eliminating it. We're not ending it. It's not going away, at least for a while. But what we can do is create capacity in the healthcare system. And when that happens, most people do not get so sick that they need a hospital. And those that need a hospital, for the most part, recover when they get good health care. But when we don't have capacity because of this exponential increase in cases is when we get into trouble. So why are masks and social distancing so important as we relate to the virus? Because we want to keep capacity in the system. We have this exponential growth of transmission when we don't do these things. And because many, many people are asymptomatic. I almost always want to say asymptotic, but they're asymptomatic. And what that means is that they don't know they have the virus. And many of us, that's probably the case for right here in this county and in this valley and in this city. So many, many more people have had the virus than have been documented and that are known to have the virus. And that's why all of these measures are so critical, because it's not the people that are sick. Believe me, no one is going to put up with that anymore. When you're standing somewhere and the guy next to you has a runny nose and is blowing his nose and sneezing and coughing, you are going to lay him out, right? You're going to say something, you're going to move away, you're going to say, go home, get out of here, get away from me, whatever it is. But it's those people that don't have any appearance of illness that can very easily transmit the disease in this very same way. So this is why these measures are so important. All right. So moving beyond that, let's talk about what's actually going on here, which is how we're reopening. So Colorado has a new order that just came out Sunday, and these are the high points for it, which is that businesses in Colorado in a stepwise fashion can now reopen. And by the way, we have much more rigorous rules and very specific rules here in Eagle County, which I will speak to shortly, which of course apply to us here in the town of Eagle. But in Colorado, we can now start to operate under some very specific limitations. And one of the things I want to really point out more than probably anything here is that all of this implies that we can have the appropriate personal protective equipment, the appropriate spacing, 6 foot of distances or social distancing, that people that are sick are not coming to work or getting around other people, and that we're limiting unnecessary travel. So this isn't like go back to normal. There is no more normal anymore. Okay, this is all some time ago. That world doesn't exist anymore. But to the extent we can comply with these measures, yes, it is possible to open businesses. It is possible to do certain limited things, okay? It's not just go get going like we did before. That does not exist anymore. That's not an option, and it won't be an option for a very long time, okay? And the other thing that I would say more than anything to take away, and this is at all levels, is that vulnerable populations should continue to remain isolated and stay away from other people and not engage in any kind of congregating activities. If you are vulnerable, if you have a compromised immune system, if you're elderly, if you have other issues that are specific to that, you really need to continue to protect yourself in the maximum way possible. And again, that is because the virus has not gone away. The fact that we're opening the state and opening the county does not mean that the virus has gone away. Very important takeaway for everybody. All right. Eagle County has, as of last week, beginning Monday, a new phase 1 order. Of course, this is an incremental thing, meaning we're going to lift in, things incrementally. We're not going to do it all at once. And the key is that we have to prevent the resurgence. If we are not responsible about how we do this as a community, and the curve cranks back up, and we overwhelm our system, I promise you, we will immediately go back into lockdown. It will be necessary that we go back in lockdown. It will be critical, and it will be ordered. And so it's inherent upon all of us to be responsible about following these procedures, or we will be right back where we started. So some key components of the order, and of course, everyone can go read this order and get the details of it, but the key components I'm going to touch on here. We've expanded beyond just essential businesses, which means now that other businesses can open up. It's not only essential businesses. Other businesses are now capable of opening. It also offers a definition of what are local residences, local residents, and that does include second homeowners. And the reason for that is because the county viewed that as a very important economic driver for the area, which means that if you own a home in the county, you can come to that home, you can participate under the rules of this order, as well as anybody that lives here permanently, right? If anyone is symptomatic for any of the exposures, they have to be isolated. That's very important. And you're going to find that some of our civil liberties are going to be challenged under this program, because as we find problems, the critical key to controlling that is going to be exploring how that may have impacted other people, meaning who they may have contacted, who you may have been in touch with, family or otherwise, and get to those people and get them tested and get them isolated to the extent that it's determined that there's risk for them. Again, we continue to have the maximum of 10 persons for any kind of gatherings. There's actually more significant restrictions than that, which relate to, you know, if you can't social distance and if you can't protect, it's not 10 people is not okay. but the maximum is 10. So things like big gatherings are, not going to be happening anytime soon. There's a recommendation for the use of cloth masks. We don't want to be shaking hands and hugging and whatever, so we're staying apart from each other. There are travel restrictions. So we're talking about limited travel only for local residents. So we're not talking about driving all over the state of Colorado. I thought this was an interesting one. Short-term lodging is still prohibited. So hotels and motels and things of that type, bed and breakfast, unless it's for locals or it's an emergency situation, meaning a storm hits the pass and people need somewhere to stay for the night that have been passing through on the highway. That would be acceptable. They could stay in a hotel, but not someone coming up to recreate. Okay. And there are things that are staying closed: dine-in restaurants and bars, preschool to 12th, so school is staying closed. And I think we should all expect that, when school is over, things that kids might have normally be doing are probably also going to stay closed. I mean, there could be some changes to that, but I think we all expect that. We're not going to be sending kids off to summer camp and things like that this summer, at least as we sit here today. Additionally, there's some very, very important protocols here, which I've given you the link for, which is the very specific work plan that you have to establish for social distancing to reopen your business. This is a very critical program that Eagle County has provided for you if you want to use their format, or you can use it as a guide and create your own. But you have to create a social distancing protocol in a written plan. So this can't be something you just, think to do as a good idea. It actually must be a written plan, and it must be posted at your establishment. So it's got to be available for anyone to see or look at or read. And so anybody coming into your establishment must be able to see this program, and it has to lay out all those things that are necessary to both protect your employees as protect any customers, visitors, guests of your establishment. It also requires that we have to do self-screening. So that means that any employees in your business have to be self-screened each day for temperature, for any symptoms. And there's some very heavy requirements on hand sanitizing and disinfectant. And I think this is an important point to bring up because while there is this order that allows us to open businesses again, you can't do it unless you are able to meet these protocols. So it's not just a free pass here. It's not just businesses are open regardless. It's businesses are open if and only if you can do these things. You have your order and you have your protocol in place, you have it posted, you're self-screening, you can maintain social distancing, you're wearing masks, and you have these things available like hand sanitizer and soap and water disinfectant. You have to be able to provide those. Well, that's a problem in some places. You may not be able to get your hands on this stuff in order to make it available, in which case, guess what? You cannot open. Your business can't open, okay? Same thing, you have to have procedures for contactless payment. If you don't have that, you can't open. Right? If you can't do these things, it's not possible to open, all right? And then there's this very Colorado trail map, right? And I apologize, this didn't come across as well as I would like, but you can find it in the link that I provided you. But this gives you sort of the short story of how we're opening. And of course, what we are is on the beginner slope right now. We are only in the green column. We can only do those things in the green column. And as I said before, if we don't comply with those things and those don't follow through and they don't work, then you never get to intermediate. Intermediate is the next step. And if you can read it, what it says is it takes about 4 to 8 weeks after complying with beginner steps and not seeing a spike in cases. So what's going to happen here is we're going to open with these initial protocols. And if we do it right, and if it works, nobody knows the answer yet, then there is some chance that we will get to being able to move to the next step. If that doesn't happen, we won't be able to move to the next step. Okay? If we start seeing a spike, we're going to lock back down, and then we're going to go all the way back to the beginning and start again. The next slide talks to the federal rules. So I'm moving off of the county rules. I'm going to come back to some best practices to sort of break those down a little bit. But I want to make sure everyone is also aware that there are federal rules governing this. And that is, again, a gating criteria, a phased approach to opening businesses. And again, as is the case in this country, local rules, home rule tends to trump federal. So as long as you're compliant with federal, your home rules can be more stringent, and that is the case here in Eagle County. They are more stringent, and therefore we meet all the obligations of the federal rules. But the federal rules work in a sort of similar process where you've got to have a bunch of stuff in place: capacity in hospitals, management of cases. They're not increasing. You're controlling, managing people with symptoms. You have the ability to test and capacity to do that. And then there's a phased approach to opening businesses and allowing people to start to be around each other a little bit more. And again, everything we're doing in the county complies with what would be required at the federal level. And we'll see that I think we're well ahead of any of the programs there. But these are programs that are also available at the federal level. And then I want to make sure everyone's aware of some other great resources for you. The Center for Disease Control has a lot of information out there, best practices. This is a good fallback for any business owner outside of just the orders to know sort of very reliable information about anything you'd want to know about the virus and reopening businesses. And again, it really focused on all those same themes you've been hearing about so far today that I've been reiterating, which is the use of masks, social distancing, daily health checks, disinfecting and cleaning, and very importantly, maintaining wellness of critical workers. And I think this is worth highlighting. The CDC's focus is, of course, that separating what probably most of us are interested in today, which is non-essential businesses. How do we get back opened up? What's even more important than that aspect is that the employees at the critical businesses are able to come to work because they're not sick. And if we can't run the sewer system and run the electric system and pick up the trash and have our governments operating and the critical infrastructure and telecommunications and cell phones and email and all those kinds of things, because all those workers are so sick they can't come to work, that's way more problematic than whether we can go get a coffee or a donut or lunch down at our favorite store. And so that's also part of our responsibility. And the CDC is very focused on that. And as you read some of their information, you'll see that. And of course, importantly, I'm giving you some references here for OSHA regulations. I think any employer understands that the Occupational Safety and Health Administration is the governing body for protecting employees and creating a safe workplace for employees. And the important takeaway here is that the COVID virus is now a reportable condition, and there are obligations for employers under OSHA to protect their employees. And this is a big deal, and the reason, frankly, it's such a big deal is because what we don't want to have happen as employers is have lots of phone calls to the health department by our employees who are fearful of coming to work, that feel they're not being adequately protected, or have whistleblower type conditions starting to develop. So it is very important to be tuned into the fact that this isn't just an order that falls within the county. This is an order that we all have to be cognizant of as business owners under OSHA. We have separate and very significant legal obligations under OSHA that apply to our workers. Okay. So I'm going to lead to a couple best practices and some takeaways here, and we'll start winding down the presentation. But the important thing here is it's not over. We all need to plan to live with this. It's a very important factor. The virus hasn't gone away. And in fact, today, the virus is no different than it was on March 7th or 8th or 9th or when this all first started. It's just as much out there and prevalent. It's just as capable of getting you sick and or killing you. And it isn't going away anytime soon. Best cases, I'm hearing that vaccines might be out in 2021. There's a lot of varying information about that, but I think it's realistic as we sit here today to be having an expectation that is probably in 2021 for a vaccine. There is no doubt that the virus is going to rebound. There is no doubt that as we open things up, we're going to have spikes in cases. That's unequivocal. And it's all still here. And I would tell you one thing which I think is an important aspect as business owners is we want to be able to find a way to continue to work while not only this virus is occurring, but maybe future viruses are going to come. These pandemics are not over. And what I think we want to be in position for as businesses is to never have to be shut down like this again, to be able to operate amidst a virus of this type. That is really critical for us as business owners, as a business community to figure out. And these procedures that we're creating are the first step in that process. But that's going to allow us not only to operate while this virus is still occurring this year, it spikes and comes back, but also when future ones come up, so we never have this problem again. So we never lose the economic force of operating, which is where we're at right now because we were so ill prepared, right? So what we want to do is be prepared to be able to function in this new environment. So I'm going to talk to you about some best practices here. This is a little outline of a couple last items I want to get to you here. And I want to be cognizant of time, so I'm going to move along to some of these. I think it's important that we, as employers, consider both inward and outward facing factors. In this case, when I talk about inward facing considerations, what I'm talking about are our employee concerns for safety. You may think that all people want to do is get back to work and start making money again. That is not true. People are scared to come back to work, are concerned about coming back to work, and believe me, are going to let you know that when they get back in your workplace. And in addition to that, it's necessary for us to keep a healthy workforce. If what happens is we bring all our people back to work and then we get them all sick, you're going to be back in the same spot. Your business is going to be closed. You're not going to be able to operate because you're not going to have workers that can keep your business open. So it is just as important that we are protecting our workers as ourselves, because otherwise our businesses will not run. And then more, very importantly for us, this is opening an entire new world of potential whistleblower and claims and litigation that could come from employees to employers. This is a new world of things, and I think you should expect that this is a real risk. In the open hotlines that have been set up around the country by all these different health departments for various reasons, I can tell you what the vast, overwhelming majority of calls are employees complaining about the work environment of their employer, asking why their business is even open, saying that they're not doing proper things, and basically whistleblowing on their employees. That is what's going on almost immediately, and by far and large the calls that are coming in right now. So it's really important that as employers we keep an eye on that, and that we recognize that it's so important to follow these different things so that our workforce stays vibrant and healthy and confident. And then there's, of course, outward facing considerations that I think are really important for us as businesses that involve the public. Many of our businesses don't necessarily, but a lot do. Hair salons, bars and restaurants, insurance agencies, banks, grocery stores, you name it. When you have guests that are coming in, it's very important that you consider some of these factors. And the ones that are important to me, I think, really are the ability to build confidence in the public. Let me tell you something. It's hard to imagine that anyone on this call is going to open the door to their favorite coffee shop, see 10 people standing crowded together in line waiting for their coffee, and walk through that door and come into that establishment. I mean, I know what I'm going to do. I'm going to turn around and go the other way. And I think that's how most people are going to feel if we're not seeing that companies are following this. And so it's very important that we have these outward facing considerations so that we can build confidence in the public and have their interest in wanting to come to our establishments again, and feeling comfortable that they can do it without getting sick. And by the way, that they're not getting our employees sick, because that's just as much of a problem. We're right back into the loop that I talked about before, which is you can't get anyone to come to work. I'm strongly encouraging anybody planning to reopen their business to have a written plan. I think the county's format is a good start. You can see just a little excerpt from our own company plan here at Partners, but you need a written plan. You are really sort of out there without an anchor and without a support and without a net. If you are trying to open your business without having thought through a written plan, it forces you to sit down and consider all these different pieces that apply. And by the way, they're not generic. They're very different for each company and each business. They're very particular to your way of business, and they may relate to whether you can stay in business. The fact that the county requires a certain level of social distancing may be in conflict with what it takes you to run your business in a profitable way. You may not be able to get enough throughput in your store. You may not be able to serve enough meals in your restaurant. There may be things that are preventing you from being profitable. That's a consideration in all this, okay? So written plan is just frankly critical, I think. And again, the county, if you take a look at my link, has given you a really nice starting point. It's their minimum standard. I would say that's the place to start. You're also going to need some really significant new work procedures. And again, I'm just strongly recommending all these as important best practices. You've got to have some health checks. They got to be reliable. You have to be able to clean and disinfect. You need to continue to encourage remote work and have the ability to do that and control the throughput of employees into your office, the number of people. You know, you may say, well, look, I can get everyone in their cubicle, they're 6 feet away, and I can get my 50 people back in my building. Okay, that's great. What are they doing when they walk to the bathroom down the hallway? You know, how close are they coming to each other? How many times do they have to cross each other? Is your lunchroom going to be open? You know, these are all things that you need to work through and make sure that you're establishing. And then you should be aware that you're going to need masks, and you're not going to want congregating, and you're going to want to continue to support all these practices that have been in place from remote work. Here's an example of a health check form. This says, you know, for subcontractors, this could be for your own employees, but I thought I'd give you an example here of what questions you should be asking, what things people should be doing as part of this. This isn't just a, yeah, I feel okay, I'm coming to work. If that is the process you follow, here's my guarantee. You'll be back shut down in a couple weeks. People will come to work, they'll be sick, they'll get other people sick. It'll take 10 or 15 days till that travels through your workplace, and then you'll have nobody working. And then you'll be in the paper, and then no one will come to your facility, right? That's the chain of events. So it's going to be really important and inherent that you're rigorous about this. And then I think it's important that you engage the public. In situations like this, the more transparent you are, the more that I think you give confidence to the public, your guests, the people you want to come and spend money in your establishment, the more confident and comfortable I think they will be in coming there. I know for me, after 9/11, it was really awkward to see all the security measures that were in place, right? But boy, did I feel better about getting on a plane knowing that that those things were being done, right? Well, I think this is the same kind of concept. Yes, it's going to feel a little odd to talk about all these things, to open yourself up, to explain what you're doing, to publicize this, which, by the way, you're required to do here in Eagle. But I think if you do that right, if you build up a marketing campaign around this, if you embrace this process, I think you're going to find that it's going to be, in the long run, beneficial, and it's going to create that confidence in people coming. And using your business again and feeling comfortable they can do it safely. I think that's going to be a critical path for everybody. And so, again, that's one of my strong encouragements. And with that, I'm winding down. I know I threw a lot at people, and there maybe are some questions that have come about, and we can certainly go through those as needed. Mary Ann, I'll leave that up to you. And I want to try and get my screen on. which I have to figure out my way to here.
Well, Dan, we do have some questions, but I think we will also just open it up. Anyone can, I would ask you to unmute your speaker and ask your questions. And we had two good questions that I thought we do need to address. And one came from Aaron Vagan regarding garage sales, which I think is a great question because it's that time of year. And then Carrie had one about summer camps for children. Do you have any insight on it, or we're going to refer them to the county on that?
Well, is the question about the garage sales a question of, can you have a garage sale? Is that the question?
Yes.
So I can't recall a specific reference to the garage sale as, you know, something specifically in the order, and I'd want to just sort of read it one more time to reflect, because it probably wasn't highest on my list when I read it over. But my suspicion is that it would fall under the same process. It's not a specifically designated thing that can't be done. For example, like going back to school is specifically identified as something that's not going to be done. So I would say that a garage sale is something that may be possible, assuming you can comply with all of the other requirements that are presented there, which would be wearing a mask, social distancing, having a plan, you know, self-health check, not letting people congregate more than 10 people, posting your plan. I mean, I would say that would make sure that you can comply with any and all of the other requirements that relate to how you could operate something. So I would say acceptable, assuming you can meet all the other components. But I would also say it's probably the first time I've thought about that. And, you know, you'd want to look closely back at the rule to make sure that there's not something specific in there that would make that not possible. But my suspicion is it would be okay if you can comply with all the other aspects of the order.
And also, Carrie Schroeder asked about summer camps, and I'm thinking, leave it up to you, but that is a big issue for a lot of families in the county, as both parents do return to work and they rely upon summer camp to take care of their kids during the day. How do you see that working out?
My expectation is that summer camp is going to be in the same category as school. And until something develops relative to school-related activities, I think you're going to find that summer camps are not going to open. Now, I haven't seen that specifically listed because I just think it's a little too soon at this point. But it's hard to imagine that that is going to be allowed any more so than schools. Now, the other side of that is, as you get to the intermediate stage of our reopening plan, some businesses and gatherings and components are possible. And it would simply be a function of, if we in time get to intermediate or expert stages, if you want to go back and reflect on the trail map guide, that if we advanced far enough along, then we would reach a point at, you know, gatherings and other things starting to be viable, and those would be the triggers. And I'd have to open up that trail map again and see, under intermediate, is it possible that, you know, larger gatherings would be allowable and things like that. Now, it's also possible that there would be new and unique ways that businesses like a summer camp could somehow open and comply with all of these very intricate requirements. I'm not entirely sure what that would be, but not unlike businesses that can open and maintain social distancing and things like that. I mean, there may be some unique perspectives that, you know, the owners of summer camps figure out to allow some form of that to occur. It's hard to imagine as I sit here. So as I'm sitting right now, my expectation would be that summer camps aren't going to be opening this summer. It seems hard to imagine that within a month or two, we're all going to feel so comfortable that, you know, we can start to have hundreds and thousands of kids mingling, you know, amongst each other. But that certainly could change, you know, and I think that that's yet to be seen as would be the answer. But as I'm sitting here, I would be planning for how to function without that, just in the way that we functioned without school for some time.
Dan, I've had some emails from particularly the retail community in reopening, and I do see that they can open with guidelines. They can, a retail shop can open with curbside delivery now, as well as letting people in the store starting, I think, as of Friday. My question here is, how is a retail store to enforce guidelines for the social distancing they can take care of by limiting the number of people in the store, but it's the sanitizing of their surfaces. Are they going to allow people to come in and touch what they do? You know, because we're all touchy-feely people when we go shopping. How is that going to work in a retail situation?
So I think this is in the category, Marianne, of that's a very specific decision that's got to be worked through by that particular you know, facility. So I'll give you my example in my own company. So our company is, you know, consultants, and we have an office of about 25 people in one particular location. So that creates a lot of questions. And we have gone literally sort of step by step into a conversation about how we are going to disinfect offices, how we're going to disinfect common areas, whether we're going to have meetings or not, whether we're going to allow people in the lunchroom. If you go in the lunchroom, are you going to use the plates and cups that were used to be used for common use and put in dishwashers, or now we're going to be disposable? And we've determined all sorts of things, like we're no longer going to have coffee available for people because people can't touch the coffee maker and things of that type. We're going to not have food left in refrigerators. We're going to have wipes and disinfectants. So how that applies at a retail facility, again, I think is a very specific conversation about your facility and what people can and can't touch and what they do there. A clothing store is different than a bookstore, is different than a coffee shop. Those are all different approaches. But what I would say invariably is that if you can't provide the disinfecting process, whether by a janitorial service that comes in periodically and or the things you have to have on hand immediately as of that day, or gloves or masks, then you simply can't open. I mean, that's the reality of it. If you can't obtain disinfectant, hand sanitizer to have available for your employees and your customers, you cannot open. And maybe you'll say, well, I'm going to open. Okay, fine. Here's what's going to happen. You're going to open, someone's going to come in, they're not going to find hand sanitizer, and you know what they're going to do? They're going to call the county health department, and the next person who's going to come to your door is going to be the county health department and maybe the police department, and then they're going to get shut down because you're not going to be complied with the order. This is not like a friendly, you know, suggestion. This is the order by which you have to operate. So I think those are decisions that have to be made by individual business owners relative to what is going to be acceptable to protect their employees and to protect the outward-facing public. And I can't say what the answer is on every individual possibility. And your point is a really good one, but I think you're going to have to just take that step by step with your individual business.
Okay, now, I open the conversation up to ask any questions. We have still a number of people logged in with us. So if you will unmute your mic and ask your questions, we'll be glad to help. I think one of the first things that I do want to let those who are participating today to know that Dan's presentation is included in our weekly e-blast that will be going out in about an hour from now. That's already set up. And also, if you would like, I can send you a good, clear copy of the county's transition. They call it the transition trail map that you can print and put up at your offices if you like. So I will make a note of sending that out to you as an attachment in an email so that you will have that there for your use. Chuck, I see that you have unmuted your mic. Are you ready to ask a question?
No, I was just understanding how to use this Zoom video because we had a hard time getting logged in this morning and took us quite a while to get this figured out.
Well, I will tell you, for all of us, this is a new tool, office tool. And as Dan has said, a lot of things are changing. And I think Zoom meetings are going to be around for a long time. I think we're going to all on a major learning curve dealing with this Zoom. So yeah, but if you have a question, please ask it. Dan, I know you have shared your office's guidelines that you are posting regarding reopening your business. Are you aware of any other template that is available that we could share with our participants here so they can post one at their business? And I must say, it is important that this must be posted. And I am seeing it on doors of businesses, but I think it's got to be a little more extensive with the new guidelines. Dan, what's your point?
So Eagle County, again, if you follow the link from my presentation or just go there yourself, Eagle County has created a form, and certainly, Marianne, we could put it up on the Chamber's website, that is a fill in the blank form for your social distancing protocol, which is the name of the plan that they're talking about. I'm suggesting that probably isn't going to go far enough. That to me is sort of the minimum standard that is sufficient for you to get reopened and is very thoughtful and well made. And if you walk through it and fill it out, it meets all the requirements and is very user-friendly and extremely well done. All I'm sort of pointing to is your individual business, how it's configured, how it's set up, your risk tolerance, your employees' risk tolerance, may require you to dig a little deeper than just filling in the blanks on that document. And here's one piece of advice that I will offer, which is under no circumstances should you, as a business owner, create a plan that you then cannot abide by. All right? Creating a plan, very important, necessary to get open. Creating a plan that you don't follow is a guaranteed lawsuit. Guaranteed. And a losing one, okay? The last thing you want to do is be standing up there on the stand after you've been sued by some employee that got sick badly, and maybe a family member got sick, or maybe, horribly someone, passed away, and now your business is being sued about this. And they pull your plan out, and it says you were going to do A, B, and C, and it very obviously never occurred. That's going to be a problem. It's going to be a big problem. And so I can't articulate this enough. As business owners, you want to be prepared with a very understandable, simple, enforceable plan that you can follow effectively, or you're going to be exposing yourselves and opening yourselves up to problems that did not exist 60 days ago in your business. Okay? Very, very important that it's a thoughtful plan that is understandable by your employees, that covers all the things that could come into play for them, and also addresses those concerns that could come from outside the store. Because this virus is going to be floating around and people are going to be getting sick, and that is going to create problems. Okay.
Great. Well, Dan, I thank you very much for sharing all your insight into businesses reopening in light of the COVID-19, because this is a new day, a new beginning for all of us in how we're going to operate our businesses. I can assure you that the Chamber is here. We may not have the answers directly, but we will certainly help in leading you in the right direction to get them. You have Dan's email if you wish to contact him. We are going to continue sharing all of the information that we receive from the feds, the state, and the county regarding reopening businesses under the COVID-19 guidelines. And we'll be keeping this up. If you have any particular information that you would like us to have a program on, please email me here at the Eagle Chamber at info@eaglechamber.co, and we will continue these programs. As I said, this presentation is in today's e-blast. I'm also going to create a special link to the fill-in-the-blank guidelines for reopening your business, because that will be a great help to a lot of people who figure out, how do I begin this process? And we will work this out together, and together we will be a stronger community, and will continue to be a great place to live, work, and play. So Dan, thank you for your presentation today. Thank you for all of our participants for signing in, and have a great day and a healthy day. Thank you.
Thank you.